Blood clots can be life-threatening, yet many people don't recognize the early warning signs. These clots can silently develop in your veins or arteries, leading to serious health complications. If a clot blocks blood flow, it can cause a stroke, heart attack, or lung damage. Recognizing the symptoms early can save your life and prevent long-term damage. Some warning signs are easy to overlook, making it crucial to stay informed. Leg pain, swelling, sudden shortness of breath, and chest discomfort may indicate a hidden clot. Many people mistake these symptoms for muscle cramps or fatigue, delaying treatment. Ignoring the signs can allow the clot to grow, increasing the risk of severe complications. Blood clots often form after long periods of immobility, dehydration, or medical conditions. Understanding the risk factors and symptoms can help you take proactive steps to protect your health. Lifestyle changes, hydration, and movement play a key role in preventing dangerous clot formation. This video will cover the most alarming symptoms of blood clots that should never be ignored. We will also discuss risk factors, causes, and what to do if you suspect a clot. If you or someone you know has these symptoms, seeking medical help immediately is crucial. Early treatment can prevent deadly consequences and improve recovery chances. Stay with us as we break down everything you need to know about blood clot warning signs. Don't wait until it's too late, these symptoms could indicate a serious medical emergency. If you find this information valuable, make sure to like and subscribe for more health updates. 1. Understanding blood clots, what they are and why they matter. Blood clots are gel-like masses that form when blood thickens and clumps together. They play a crucial role in stopping bleeding after an injury, but sometimes they develop inappropriately inside blood vessels. When this happens, they can block circulation and lead to life-threatening complications. Clots can form in veins, venous clots, or arteries, arterial clots, and both types can cause serious health issues. Arterial clots can lead to strokes, heart attacks, and tissue damage due to restricted blood flow. Venous clots, such as deep vein thrombosis, DVT, can break loose and travel to the lungs, causing a pulmonary embolism. Understanding how blood clots develop is crucial for early detection and prevention. Risk factors such as prolonged immobility, smoking, obesity, and dehydration increase the likelihood of clot formation. Certain medical conditions like diabetes, cancer, and genetic disorders can also contribute to clotting problems. Blood clots often go unnoticed until they cause severe symptoms, making it essential to recognize the warning signs. By staying informed, you can take steps to reduce your risk and seek medical help when necessary. Recognizing early symptoms can make a significant difference in preventing complications. Blood clot prevention includes lifestyle changes, hydration, and proper circulation maintenance. Knowing how and why blood clots form empowers you to take control of your health. If you suspect a blood clot, immediate medical attention is critical for avoiding serious consequences. 2. Unusual leg pain and swelling, a warning sign of DVT. One of the most common signs of a blood clot is unexplained leg pain and swelling. Deep vein thrombosis, DVT, occurs when a clot forms in a deep vein, usually in the legs. The affected leg may swell significantly, appearing larger than the other leg. Pain may start as a dull ache or cramp but can become severe over time. Some people describe the pain as a deep, throbbing sensation that worsens with movement. The skin over the affected area may feel warm, tender, or even change color. Red or bluish discoloration of the skin can indicate poor circulation due to a blocked vein. DVT often develops after long periods of sitting, such as during long flights or car rides. People recovering from surgery or bedridden individuals are also at high risk of developing DVT. Ignoring these symptoms can allow the clot to grow, increasing the risk of it breaking loose. If a DVT clot travels to the lungs, it can cause a pulmonary embolism, which is life-threatening. If you experience persistent leg pain, swelling, or skin changes, seek medical help immediately. A doctor can diagnose DVT using ultrasound imaging and start appropriate treatment. Blood thinners are often prescribed to prevent the clot from growing or causing further complications. Taking precautions such as moving frequently and staying hydrated can help prevent DVT. Awareness of these warning signs can protect you from a dangerous and potentially fatal condition. 3. Sudden shortness of breath, a sign of pulmonary embolism. A blood clot that breaks loose and travels to the lungs is called a pulmonary embolism, PE. This condition is extremely dangerous and requires immediate medical attention. One of the first warning signs of PE is sudden and unexplained shortness of breath. It may feel like you can't catch your breath, even while resting. Some people experience a sharp, stabbing chest pain that worsens with deep breaths. Breathing may become shallow and rapid, leading to dizziness or lightheadedness. If oxygen levels drop, the skin and lips may take on a bluish tint. Some individuals also report a racing heartbeat or palpitations due to reduced oxygen supply. Coughing, especially with blood-tinged mucus, is another serious symptom of PE. Pulmonary embolism can be fatal if left untreated, making early detection critical. It often develops after deep vein thrombosis, DVT, when a clot travels through the bloodstream. Prolonged bed rest, recent surgery, or certain medical conditions can increase PE risk. Dehydration, obesity, smoking, and hormonal medications can also contribute to clot formation. If you experience sudden breathing difficulties, do not wait, seek emergency medical care immediately. Doctors diagnose PE using CT scans and blood tests to check for clotting abnormalities. Treatment usually involves blood thinners to prevent the clot from growing or forming new clots. In severe cases, clot-dissolving medications or surgical removal may be necessary. Preventing PE involves staying active, moving during long travel, and staying well hydrated. Knowing these symptoms can help save lives and prevent fatal complications. 4. Chest pain and discomfort. A possible sign of a blood clot. Chest pain is often associated with heart problems, but it can also indicate a blood clot. When a clot forms in the lungs, heart, or major arteries, it can restrict oxygen supply. The pain may feel sharp, stabbing, or like pressure squeezing your chest. It often worsens when taking deep breaths, coughing, or lying down. Some people mistake this pain for indigestion or muscle strain, delaying medical attention. If a blood clot blocks an artery supplying the heart, it can trigger a heart attack. Symptoms like sweating, nausea, and dizziness often accompany this type of clot. A pulmonary embolism, PE, can also cause sudden and intense chest pain. When blood flow to the lungs is reduced, oxygen levels drop, making breathing difficult. If untreated, PE can lead to severe complications, including lung failure or sudden death. Blood clots in the heart or lungs require immediate medical attention to prevent fatal outcomes. Clots can form due to prolonged inactivity, dehydration, or existing health conditions like diabetes. Individuals on hormonal medications, such as birth control pills, are at a higher risk of clotting. Smoking and excessive alcohol consumption can also increase the chances of blood clot formation. If you experience chest pain with breathing difficulties, seek emergency medical care immediately. Doctors may use imaging tests like CT scans or ultrasounds to confirm the presence of a clot. Treatment often involves blood thinners to break up existing clots and prevent new ones. Lifestyle changes, such as regular movement and hydration, can help lower your risk. Recognizing the warning signs early can prevent dangerous complications and save lives. 5. Severe headaches and vision changes. A sign of a brain clot. Severe headaches are common, but in some cases, they may indicate a dangerous blood clot. A clot in the brain, also known as a cerebral thrombosis, can lead to a stroke. This happens when a blood vessel supplying oxygen to the brain becomes blocked. The headache may feel different from regular migraines, often described as sudden and extreme. It can be accompanied by dizziness, confusion, and trouble speaking or understanding speech. Vision changes, such as blurriness, double vision, or sudden blindness, can also occur. Some individuals may experience weakness or numbness on one side of the body. This type of clot can lead to a stroke if not treated immediately. Blood clots in the brain can be triggered by high blood pressure, smoking, or dehydration. Individuals with diabetes or those who have experienced head trauma are also at higher risk. Long periods of inactivity, such as extended bed rest, can contribute to clot formation in the brain. If you or someone you know experiences these symptoms, seek medical attention immediately. Doctors may use MRI or CT scans to diagnose blood clots in the brain. Treatment often includes blood thinners and clot-dissolving medications to restore normal circulation. In severe cases, surgery may be required to remove the clot and prevent further damage. The best way to prevent brain clots is to stay active, eat a healthy diet, and manage stress. Avoiding smoking, limiting alcohol consumption, and staying hydrated also help reduce the risk. If a headache is unusually intense or accompanied by neurological symptoms, do not ignore it. Recognizing these signs early can mean the difference between recovery and severe brain damage. 6. Sudden arm or leg weakness. A sign of circulation blockage. Of sudden weakness or numbness in the arms or legs can indicate a blood clot. Clots in the arteries supplying the limbs can reduce blood flow, leading to severe complications. This condition, known as peripheral artery thrombosis, can cause extreme pain and tingling. The affected limb may feel cold to the touch due to restricted circulation. Skin discoloration, such as paleness or a bluish tint, can signal an urgent issue. Some people experience difficulty moving their arms or legs due to nerve impairment. If left untreated, this condition can lead to tissue damage or even amputation. Clots in the limbs can form due to high cholesterol, diabetes, or prolonged immobility. Smoking, dehydration, and excessive alcohol use can also contribute to poor circulation. People who sit for extended periods, such as office workers or travelers, are at higher risk. If you notice sudden weakness, numbness, or color changes in your limbs, seek medical help immediately. A doctor may use ultrasound or blood tests to detect circulation problems. Treatment usually includes blood-thinning medications to prevent further clot formation. In severe cases, surgical procedures may be needed to restore normal blood flow. To prevent blood clots in the limbs, stay active, stretch regularly, and stay hydrated. Compression socks can help improve circulation, especially during long flights or car rides. Eating a balanced diet with heart-healthy foods can also reduce clot risks. By paying attention to early signs, you can prevent serious complications and protect your health. 7. Unexplained fatigue and shortness of breath. Hidden blood clot symptoms. Fatigue is a common complaint, but in some cases, it may indicate a blood clot. When the body has to work harder to circulate blood, it can cause extreme tiredness. A clot in the lungs, known as a pulmonary embolism, PE, can make breathing difficult. This results in lower oxygen levels, leading to persistent fatigue and dizziness. Some people experience an unexplained increase in heart rate, even while resting. Clots in the legs or arms can also cause fatigue due to impaired circulation. Blood clot symptoms often mimic those of other conditions, making them easy to overlook. If you feel constantly exhausted without an obvious reason, consult a doctor. Individuals with a history of DVT or PE should be especially cautious. Risk factors such as obesity, high blood pressure, and smoking increase the chances of clotting. Staying hydrated and maintaining regular movement can help reduce the risk of dangerous clots. Doctors may perform blood tests or imaging scans to check for circulation problems. Treatment includes medications like blood thinners to break up existing clots. In severe cases, clot removal procedures may be necessary to restore blood flow. Lifestyle changes, including exercise and a balanced diet, can help prevent future clots. Don't ignore persistent fatigue, especially if it's accompanied by shortness of breath or dizziness. Recognizing these early warning signs can prevent severe health complications. 8. Rapid or irregular heartbeat. A hidden blood clot warning. A sudden change in heart rhythm can be a serious warning sign of a blood clot. When a clot blocks blood flow, the heart must work harder to pump oxygen throughout the body. This can result in a rapid or irregular heartbeat, also known as palpitations. Some people experience fluttering, pounding, or a sensation of skipped beats. In severe cases, it may feel like the heart is racing uncontrollably, even while resting. Blood clots in the lungs, pulmonary embolism, can significantly strain the heart, increasing heart rate. When oxygen levels drop due to restricted blood flow, the body compensates by beating faster. Atrial fibrillation, a type of irregular heartbeat, can also increase clot risks. This condition allows clots to form in the heart, potentially leading to a stroke. Chest pain, dizziness, or shortness of breath often accompany abnormal heart rhythms. A rapid heartbeat without an obvious cause should never be ignored. Clots forming in major arteries can lead to life-threatening complications like heart attacks. People with high blood pressure, obesity, or diabetes are at greater risk. Smoking and excessive alcohol intake can further contribute to clot-related heart issues. If you notice sudden or frequent palpitations, seek medical advice as soon as possible. Doctors may use ECG tests, blood work, or imaging scans to detect circulation problems. Treatment includes blood thinners or medications to stabilize heart rhythm and prevent clotting. Lifestyle changes, such as reducing stress and maintaining a healthy diet, can also improve heart function. Staying hydrated and avoiding prolonged periods of inactivity can further lower your clot risk. Understanding how blood clots affect the heart can help prevent serious cardiovascular events. If your heartbeat feels abnormal or you experience other clot symptoms, act quickly. Seeking early medical intervention can protect your heart and overall well-being. Blood clots are a silent but dangerous health threat that can strike unexpectedly. Recognizing early warning signs like leg pain, swelling, and chest discomfort is critical. Ignoring these symptoms can lead to severe complications, including stroke and organ damage. If you suspect a clot, seek medical attention immediately to prevent life-threatening consequences. Staying hydrated, maintaining circulation, and avoiding prolonged immobility can help reduce risk. Lifestyle changes such as exercising, eating a balanced diet, and quitting smoking also improve clot prevention. Understanding your risk factors and being proactive about prevention can save your life. Many people overlook symptoms until it's too late, but awareness can make all the difference. By educating yourself and others, you can help prevent unnecessary health emergencies. If you learned something valuable today, share this information with your loved ones. Health awareness can save lives, and early detection is key to avoiding serious complications. Make sure to take care of your health by recognizing these warning signs early. Blood clots are preventable with the right knowledge and lifestyle adjustments. Stay active, pay attention to your body, and don't ignore unusual symptoms. Your health is your responsibility, and taking action today can protect your future. If you have any of these symptoms, don't hesitate to consult a doctor. Thank you for watching, and we hope this video helps you stay informed. If you enjoyed this content and want more health-related insights, subscribe to our channel. We provide valuable health information to keep you and your family safe. Stay healthy, stay informed, and remember to like and subscribe.